So our study entitled The Comparative Effectiveness of Natalizumab and anti-CD20 monoclonal antibody in relapsing-remitting MS, and this is a real-world based study. Our objective mainly was to compare the effectiveness and safety of those two therapies using data from the ECTRIMS registry, which is the largest multiple sclerosis registry in the Middle East and North Africa region. So our study was a registry-based retrospective multi-center study that was carried out in several Middle Eastern countries, and we actually analyzed data from the ECTRIMS registry. And all adult patients who were diagnosed with RRMS and who were treated with natalizumab, rituximab, or ocrelizumab and maintained on treatment for at least 12 months were included in the study. And we used propensity score matching to match all the baseline characteristics of the patients. And our primary outcome were the annualized relapse rate, the confirmed disability progression, and improvement, as well as the MRI activity. We also looked at some other secondary outcomes like the no evidence of disease activity, the NIDA-3, the adverse event, and the drug persistence. And if you want me also to elaborate on the results, so we were able to collect data on 1,954 patients who met the inclusion criteria. And after applying the propensity score matching, we match using age, sex, time since first symptoms, baseline disability progression, relapses in the previous year, and number of previous DMT. And we were actually able to match 768 patients on rituximab and 509 patients on ocrelizumab, which make a total of 1,277 in the anti-CD20 group versus 677 in the natalizumab group. So, and we analyzed data for those patients. So in terms of study findings, those study findings reveal that both therapies are effective in managing disease activity. However, natalizumab demonstrated a significantly lower annualized relapse rate compared to anti-CD20 therapy. And furthermore, patients treated with natalizumab showed a higher likelihood of disability improvement, which were not be able to detect in the patient treated with anti-CD20 therapies, highlighting a probable potential benefit for natalizumab in promoting recovery from neurological damage. And however, unfortunately, the risk of progressive multifocal leukoencephalopathy with natalizumab therapy and the risk of JC virus seroconversion led to a higher discontinuation rate of natalizumab compared to anti-CD20 monoclonal antibodies. So those are the main findings of our study. Just to sum up, so our study with its finding addresses a crucial gap in the clinical decision-making process for relapsing-remitting MS, especially those who require escalation or first-line therapy, because as I mentioned, we don't have studies comparing the effectiveness of those two high-efficacy drugs, and actually we don't have clear guidelines about the sequencing of high-efficacy DMT, and there is a lack of consensus worldwide on defining a treatment whenever the patient is treated with those high-efficacy DMTs. So by leveraging data from the ECTRIMS registry, our study offered a valuable insight into the treatment outcome within the Middle East and North Africa region, contributing to a more understanding of the therapeutic choices in MS in our unique population. And hopefully we will continue to do further analysis and further studies, publish further study using our ECTRIMS registry, which is part of the MS space. And currently we are looking at the comparative effectiveness of rituximab versus ocrelizumab.